Yes, hello, good afternoon, and welcome to a special Influence Stories. Today we are live with the president of the Florida Education Association, Andrew Spar. Thank you so much, Andrew, for joining us.
Absolutely, Helena. Good being here.
Well, we have a lot to discuss, and I know that you have been very busy the past couple of weeks, and the next couple of weeks will also be very busy for the FEA. And I want to encourage everyone to follow us on social media. You can follow Andrew, you can follow the FEA on all of the social media channels. And si hablas español, también nos puedes seguir en las redes en español que están aquí abajo para la Asociación de Educación de Florida. So it is a bilingual association. Tell us a little bit about what is the FEA?
So the Florida Education Association is the largest union in the southeastern United States. We represent instructional staff, our teachers, our guidance counselors, our social workers, our librarians, our media specialists, and then we also represent our education staff professionals, the bus drivers, cafeteria workers, custodians, paraprofessionals, office specialists, maintenance workers. The list goes on and on and on, as well as our higher education professors and graduate assistants at our colleges and universities throughout Florida.
That's a lot of people. So basically anyone that has anything to do with our public schools, from learning to be an educator, to participating in education, to keeping our schools safe and clean, our kids fed, our kids driving our kids around, all of it. So
yeah, the whole thing caboodle from pre-K all the way through till college and university level.
That's amazing. How many members do you have?
We have about 150,000 members.
That's a lot of people that you represent. So we have had some very challenging, and news-wise, we've had some very busy past couple of weeks. I want to encourage everyone that's listening to us right now to please send us your questions through the comments. Send us your comments. We will read them out loud, and we'll even post them here on our screen. If you could see them right here, and you can participate in this conversation, because we are getting ready for the beginning of the school year of the 2021-2022 school year throughout Florida. I'm in Miami-Dade County, and we start the 23rd, but just next week we have several counties beginning schools in Florida. So we have a lot going on, and last year incredible challenges with education with the beginning of COVID, and where we had to basically, everybody was sent home, and then we all started doing online school, which was an experiment, really. We had never really done anything like that. I am a mom of two little girls. My little girl started kindergarten online last year, and in public school, and right here in Miami-Dade County. So it has definitely been a challenge. Now, we all thought that things were getting better with COVID, and now we have seen that there has been quite the rise in cases. And in fact, today it was in all of the news outlets that the cases of children are definitely increasing, and many are ending up in the hospital. So tell us a little bit about what are some of the things that you have been working on as we look to return to the schools next week and the following week, when it comes to the safety of not only the teachers, but everybody that works in the school and the kids, of course.
Yeah, so Helena, two daughters in our public schools. Well, actually, my oldest is going off to college. She just graduated. Graduated in the middle of COVID, and we're taking her to college next week. But I will say this: everyone I think was in the same position, right? We all thought the COVID is in our rear view mirror. We're coming out of it. Things are really starting to turn around. That's what we were thinking just a couple of weeks ago, 3-4 weeks ago, right? And it's true with educators, right? All the educators I was talking to, excited about the start of the year, as we typically are, right? It's going to be a more normal year. I can't wait to see all of our kids in person, not have to deal with masks, not have to worry about social distancing or COVID as much as we did. And then the Delta variant took off and spread like wildfire in the state of Florida, and continues to do it. And as you've pointed out, it's impacting children. It's impacting younger adults. In fact, if you look at the numbers, it is those over 65 that are having the least impact from COVID this time around, because so many of them got vaccinated. And I think that's part of what, we ultimately have to talk about. We're now hearing the governor say it. We're hearing other lawmakers say it's time to get vaccinated. We should have been saying that all along. And it's unfortunate, because I think what we deal with in Florida, and I think what we're seeing around the country, is the politics of division. And when you're in a health emergency situation such as we are now, we shouldn't be letting politics drive this. It should be what is right for the community. We should be able to sit down and have reasonable conversations and discussions. We should trust the experts. And I know we've been feeling that for years in education, that people don't trust us as experts and respect us as experts. And now we're seeing that even in the medical field and in the science field. But the reality of it is, experts guide us with their best knowledge and their best understanding of what's happening. And when you're dealing with something like we are with COVID in this pandemic, it's constantly changing. And so I would say right now, I think we're all in the same position, as are all teachers and administrators and people who work in our schools. We're frustrated. We're frustrated because we thought this was going to be an opportunity to really get the school year off the right way. And now we're faced with a conversation about, should we have masks in our schools? Should we be social distancing? Should I be sending my child to school? How concerned should I be? That is something that every one of us is dealing with right now. And it's very frustrating, because we thought we were done with this. We had COVID fatigue. We're over COVID. We don't want to deal with it anymore. And here it is, smack in our face once again as we start another school year.
Definitely. There is a lot to take in, a lot to consider for parents, for educators. What is the position of the FEA when it comes to masks? We know that there has been a lot of back and forth. The governor has signed an executive decision, taking it upon himself to decide for everybody else that there will be no mask mandate. What is the position of the FEA? And before you answer, I want to let everyone know who's writing comments. I see your comments. I will get to them. So go ahead, Andrew.
Yeah, so listen, our position really is the decision on masks should be one made by the locally elected school board. Here's the thing in our country, right? We respect elected officials. We should, at all levels. And we shouldn't have overreach. And the governor's executive order is an overreach, plain and simple. We're not in a state of emergency. At least he hasn't declared it as of yet. There could be a debate as to whether or not we should be. We certainly are in a health emergency situation. We are in a pandemic. And so school boards need to have as many tools as possible to ensure the health and safety of all the children who come through our schools. And so, that's their responsibility. And when the governor puts out an order saying there will not be masks, he's ignoring the local community. He's ignoring the power and authority of the school board. And he's ignoring what the scientists and medical experts are saying. And it may be different from every county. And that's why we have said it really should be up to every school district. Because in different parts of the state, there's a different approach and a different desire on how they handle the health emergency. And it shouldn't be a one size fits all. Last year was not a one size fits all. There were a lot of districts, I think Miami-Dade was one of them, that had mask mandates. And then there were some that did not, that chose not to have mask mandates. And so it really should be up to the school district, and there shouldn't be a threat. And what should drive that decision is not politics, but what should drive that decision is what is best for kids. And I will point this out. This ban on mask mandates applies only to our public schools. It does not apply to charter schools or voucher schools. It does not apply to other government buildings or government agencies. It does not apply to the private sector in any way. It just applies to public schools. Disney World has a mask mandate right now, as do a lot of other businesses throughout the state of Florida. But public schools are prohibited from doing it, even if the people closest to it, which are the school boards and the superintendents, the teachers, and administrators and staff and parents in that community, want it. The governor is saying you can't have it. I will point out, some of the counties have already said to the governor, too bad, we're going to do it. We're going to see how this plays out over the next few days, because the Department of Education, we can talk about that in a little bit more, has already come out with some rulemaking that they're going to be doing tomorrow. But we don't have all the details yet.
That's right. So, two counties have already come out and said, we are going to follow the advice of our medical professionals in our communities. And we're talking about Duval and Alachua County,
Yeah.
who said, we are going to ensure the safety of our students, and we are going to have masks. I got to tell you, I have a 6 and a 4-year-old, and they are perfectly fine wearing masks. They don't seem to have a problem. They put them on right before I drop them off at summer camp, and they're wearing them when I pick them up, and they are fine. It's us adults that seem to have a problem with this. Kids are they heal quickly. They're very adaptable. And on that note, we do have a comment that I would like to bring up. I live in Okaloosa County. We have no masks, and close contacts no longer have to quarantine. They may come to school if they are symptomatic. I am distraught. I wish there was some consistency at least across the state. Please help. What can you tell somebody who is, I assume, a parent in this county, and has, this issue of, now you don't have to even quarantine if you're symptomatic? I hadn't heard that. That's pretty amazing. What do you
Yeah,
say?
I think we had the governor did say he doesn't want quarantines. He doesn't want to close schools. He doesn't want classrooms closed. We just need to keep dealing with it and going forward. I think that's irresponsible based on what the medical profession is saying to us, right? And it was interesting. I was talking actually with the president in Okaloosa County today of our local union up there, and she had shared that as well, that there is some concern that they're not really doing contact tracing. They're not really talking about quarantining. They are doing some, but it seems to be more hit or miss. It's left up to the Department of Department of Health in Okaloosa County. And so there is some concern there. Look, we do need leadership, right? There should be some boundary set. It shouldn't be obviously the wild, wild west, but there should be some boundary set on how we make sure that our kids are safe and secure. But when you have a governor who's the leader of this state coming out saying, do not implement mask policies, do not implement any quarantining or contact tracing policies, that's very concerning. And again, it's only applying to our public schools. And I think we all have an obligation. I was talking to someone earlier today, and some people may have religious beliefs, some people may have spiritual beliefs, but in all walks of life, right? There is this theory, and you hear it, you see it in the Bible, you see it in the Torah, you see it in the Quran, you see it in spiritual readings. Caring for others is what we're supposed to do as human beings. Not being so self-absorbed or self-centered that we could care less what happens to our neighbor, our friends, our family, our loved ones, right? Yet we should. And so if that means that we have to come together as a community, which I think it does, and have some real conversations and an understanding of not just what's in it for me, as you pointed out, we heard this from teachers all over the state last year. Masks was not a problem for the kids. It was the adults who kept having a problem. And I'm not talking the educators. It was parents. If there was a concern, they just didn't want their kids to have to wear a mask. And as you were pointing out, in some districts, it's going to be just voluntary, right? If you wear one, you wear one. If you don't, you don't. Well, what happens if a parent says, my daughter will be going to school. She's a 7th grader. She's going to be going to school. She's vaccinated. She's going to be wearing a mask. But she's responsible enough. I know she's going to do that. But think about some kids in kindergarten, 1st grade, 2nd grade. What if you as a parent say, I want my kid wearing a mask, and at some point during the day, they take it off and forget about it? Is it the teacher's responsibility to remind them? And then if a parent says, I don't want my kids wearing a mask, but a lot of the kids in the class have masks on, and the kid says, well, I want to wear one too, is the teacher supposed to say, no, you can't wear one? And is it their responsibility in that sense? So by having an inconsistent policy, you also create this area where it's going to be hard to enforce in terms of how we do it. So definitely some concerns there.
Well, and also a lot of these schools, at least in Miami-Dade County, have uniforms. So I think it would be something like, well, I don't want my kid to wear a uniform, or I want my kid's shirt to be pink instead of blue, and that's a uniform. There needs to be consistency. And in this case, we have to follow the experts. We know these kids under the age of 12 cannot be vaccinated. there's a little bit of something going on here in our comments. Somebody is saying, well, kids are least likely to get sick. And if you're vaccinated, then what are you complaining about? Except kids from age 1 to 12 cannot be vaccinated at this time. And that's just facts. And additionally, as I mentioned at the beginning of this interview, more Florida children have been hospitalized with COVID-19 on Tuesday. Now, let me remind you, that doesn't mean that it says a total of 46 pediatric patients were admitted to Florida hospitals. And you may say, oh, 46 is not that many kids. Well, if you are the parent of that one kid who is in the ICU because somebody else wasn't wearing a mask, then you are going to care that it's 46 kids. And additionally, that just means that these 46 kids were sick enough to end up in the hospital. That means that there are a lot more kids with COVID with, thankfully, less severe symptoms. We know that COVID is changing, that COVID is changing into the Delta. Now there's a Delta Plus that is maybe coming our way very shortly. And each one is difficult and a little bit different than the last one. And the only way to eradicate it is for everyone to just stop getting COVID. So how do we do that?
Yeah.
We follow
Well,
these
listen.
advice.
Right. And so I will tell you, let me add a little more context to this, because I think it's important for people to know this, right? To your point, when COVID impacts you, you may have a different perspective on it than to say, oh, it's such a small number. It's such a small number. There was actually a child who died last weekend of COVID in the state of Florida in one of these counties. And I'm not at liberty to say at this point, but I think that will show in a report when the state releases a report. Keep in mind, the state's not releasing reports daily like they were when COVID initially started. And they're not releasing a pediatric report that talks about kids and the number of kids that had COVID. But I believe last week, the number that was reported for the week was over 10,000 children had COVID last week. And so to your point, Helena, they can't get vaccinated if they're under the age of 12. And so how do we protect them? Leon County Schools has actually asked the governor for permission to require masks for children in grades pre-K through 8th, so that kids who are in elementary and middle school, where they cannot get vaccinated, at least all of elementary school and a chunk of middle school, that they have the ability to have that added layer of protection. And then even with adults, we keep hearing about these breakthrough cases. And even with these breakthrough cases, people with the vaccine, and I'll be honest, I know of several now who have been vaccinated and who have tested positive for COVID. I have a friend who tested positive for COVID, and they're in the hospital right now. So it's rare. We know if you have a vaccine, you're less likely to get COVID. You're less likely, if you get COVID, to have severe symptoms. You're less likely to end up in the hospital and much less likely to die, but it's all possible. And if everyone was vaccinated, we probably wouldn't be dealing with the Delta variant the way we are now. And so, that's important for us to remember and to think about how can we be proactive and support each other. Again, to me, this is about coming together as a community and really making sure that we're taking care of one another and not just ourselves. Because if we do help everyone, then in all likelihood, we will get ahead of this. We will beat back COVID and we won't have to worry about it. And as to your point, it doesn't matter how small the number is. If it's spreading ridiculously fast right now, and it's impacting all sorts of people, especially our younger people at this point, and it's increasing among kids. And so it's not just a kid thing, right? This is a society thing. We all should take it serious.
And we've seen cases that have spiked across all age groups in Florida, but younger, like you said, most people over 60, 65 have been vaccinated because it was such a big push to be vaccinated. A media analysis revealed that the sharpest increase over the past month has occurred among kids under 12. So we have seen those spike. Yes, perhaps they are not so severe, but remember, COVID, we know very little still, and can have long-term effects that could show up later, or that could just be with this child for the rest of its life. That maybe they don't end up in the hospital. They may not end up with some sort some sort of a side effect. Now, somebody here is very adamant in our comments. What about kids that have had COVID and have natural immunity? Fantastic. They are lucky. That doesn't mean that all of the kids would have that. He's saying my 3 kids had COVID last week and they recovered in a week. Amazing. You are lucky, sir. You are very, very lucky, and you are blessed, and we are grateful that your kids are safe and healthy.
Well, and I'll just add that they are saying that people who had COVID before are getting it again. And there have been a lot of cases on that with the Delta variant. And as new variant comes into place, could that happen again? The way to stop variants is, from what I'm being told, and I am not a medical expert, so I'm not even going to pretend. But when I listen to the medical experts, what they're saying is that the best way to get ahead of this is for everyone to get vaccinated, even if you've had COVID before. And so that we as a community could get ahead of it, that it's going to take all of us. And so it just, again, I'm vaccinated. I'm wearing a mask everywhere I go now. I will be honest, I wasn't several weeks ago, but as cases have risen, I'm wearing masks when I'm going out, even though I'm vaccinated. And I'm doing that because A, I'm traveling around the state right now. Mm-hmm. B, there's a lot happening, a lot of people getting COVID, even those who have been vaccinated. And I want to make sure that I'm doing my part to try and prevent the spread of COVID. And I think we should all do that.
Additionally, I want to bring up a question that came up that has to do with what you mentioned earlier, which I think is a very interesting point. Somebody is saying in Spanish, me preocupa que el tema de nuestros niños en las escuelas sea un tema político, which means I am worried that our kids, the idea of our kids and health in school becomes a political issue. Our kids' health should not be a political issue. I think we should all agree on that. We also have a question here that I think is important, that you mentioned. Why is it that just public schools and not private, charter, etc., are part of this no mask mandate? Is it because of the weight of the state funding and politics? Why is it?
Well, I think we've seen why. To the point of the last comment, it shouldn't be political, but it is. What we are seeing is what I call the politics of division. And in the politics of division, it's what some politicians do who feel like they need to have a divided citizenry in order to get elected, or in order to carry out a mission that they want to see happen. And so with that being said, we should not allow for the politics of division to play out in our public schools or in any place in our society. I think we're much stronger as a country and as a community when we stand together. Doesn't mean we agree all the time. We can have disagreements. When the governor of the state of Florida is talking about masks in public schools behind closed doors with a meeting that was not announced in advance, it was announced after it occurred, and did not have one representative from the public schools there, not a parent, not a teacher, not a staff person, not an administrator, not a superintendent, not a school board member, not a student from the public schools, and you're talking about the public schools behind closed doors and around masks, that should give us some pause. It should let us know it seems to be politically motivated. Why else would I say it's politically motivated? A state lawmaker said we shouldn't allow masks in public schools. And then when a parent said, but then how do I keep my kids safe? The response was, I'll get you a voucher so you can send your kid to an unaccountable private school where you don't know what kind of education they're getting. That doesn't make sense. That shows a political motive. So what I believe is that there is a purpose behind what we're seeing right now on this mask debate. And we've seen it on other things. We've heard about it on immigration. The governor yesterday tried blaming immigrants coming into Florida for helping spread the COVID variant. Again, that's not appropriate. That's not appropriate at all. What we should be talking about is how do we as a community solve the challenges that we have? We do that by making sure everyone gets vaccinated and encouraging those vaccinations. We do that by wearing masks. We do that by taking other protocols like social distancing. And if we're not feeling well, staying home. Can't tell you how many times I've heard. I was literally just at getting my car repaired the other day. And fortunately, I spent most of the time waiting outside for my car to be repaired. But the guy writing up the service writer said he was sick and he's at work interacting with people who are coming in. And so again, not wearing a mask, mind you. And so again, these are the kinds of things we need to do. We need to have policies in place that allow people to stay home if they're sick. We need to make sure that we are caring for each other by wearing masks and being aware of our own health. And if we're not feeling well, not going out to eat or not going out to the store or not going to work. Those are the things we need to do right now as a community to keep from the spread and not allowing this politics of division to kind of separate us out.
There's a comment here that I would like to address, which is people are still getting they're saying that the vaccine doesn't work from Delta and you can spread it and infect people. So what is the point of vaccination? This is the same gentleman that said that his 3 kids were fine with COVID, which he's very lucky. Well, all hospitals and all medical professionals have shown, numbers show that 95% of the people that end up in the ICU with COVID, that 95% have not been vaccinated. So I think that number of 95% in the ICU are not vaccinated should maybe be self-explanatory, and hopefully it will be for this gentleman who is not citing any sources as to what he is saying. And I like to cite sources. Speaking of, you mentioned that tomorrow the Department of Education is doing a proposed emergency rule. Is there any more information that we have on that?
So we have very limited, and should be a concern. The State Board of Education is going to meet. They're supposed to accept public input when they're adopting a rule. But if you don't see the rule in advance that they're going to be talking about, it's kind of hard to comment on it. And again, it goes to this idea of why are we not being transparent as a state? Why are we rushing to get this emergency rule out there? I will point out that this emergency rule is at the direction of the governor. The governor signed his executive order, and in signing his executive order said that the Department of Education needed to make rules in order to implement his executive order. And so the rules that they have said, and they just put out a synopsis of the rule, again, not the actual rule, could have other things in it, we don't know, is that any child or any parent rather who wants their child at a school that doesn't mandate masks, if a public school mandates masks, may get a voucher to take their child to an unaccountable, often for-profit private school with taxpayer money. And so that's what they're trying to do, right? And it's this idea.
That's the emergency order that they would be discussing tomorrow?
Yeah, that's the emergency rule that they're going to discuss tomorrow. And again, we haven't seen the actual rule, so we don't know how far it goes or into what detail or how that comes about. But that's the rule. That may be all they're going to do. Remember, the governor did say he wants to defund public schools if they put a mask order in place, right, which is what has made a lot of school districts, including Broward County, for example, think twice about do they want to have a mask mandate. So we don't know if he's going to follow through on that promise, and that there may be something in that rule that says that they will lose all funding. We just don't know because the governor did say he wanted to defund public schools.
He said it very clearly, and that is an absolute threat. Now, this is another question that I think is really interesting. Teachers are wondering if they can impose masks required in their classrooms. Is that allowed? There is a high level of anxiety among many teachers. Is that allowed to do it in your own school or in your own classroom? What do you feel about that? I don't know that that's allowed given the mandate from the governor.
Yeah, so Abby, that's a great question. And I will say that my take on that would be no, that teachers do not have the authority. It rests with the school board. And keep in mind, the governor didn't say school boards can't have a mask mandate. He said if they do, there's going to be a sharp penalty. So school boards still have the authority to because I believe it's within their constitutional right to implement a mask mandate. I do not believe the governor has the constitutional authority to defund public schools if school boards, in fact, do implement a mask mandate. And so, that's going to be the real question as to whether or not he follows through on that. And we will see tomorrow when the State Board of Education adopts this rule, what that truly is going to mean. But I do not believe teachers on their own could implement, or ignore for that matter, any mask mandates that may be authorized or not by the school board.
Correct. Now, also, let's talk about this $11 billion in federal funds that are intended for school districts to assist in COVID recovery. What is Florida doing with this 11 billion federal funds?
So I'm glad you asked that question, Helena, because, while the governor is saying there's not going to be mask mandates, there are, again, I don't believe we should just be hung up on mask mandates, right? There are other things we should also be doing in our schools. Extra cleaning, making sure that we're doing sanitizing on a regular basis in our schools, adding air purifiers to the classrooms to make sure that we're keeping the air as clean and healthy as possible. All of those kinds of things could be done. A COVID leave for employees who are quarantined because they've been exposed to someone with COVID or get COVID themselves. Extra testing in our schools. These are all things our schools can do with these federal stimulus dollars. But these federal stimulus dollars that were passed under both President Trump and President Biden and have been sent to the states, our state is holding up the money. The governor is not allowing that money to completely be dispersed. Some of it has, round one, if you will, of the 3 rounds of federal stimulus money has been released to the districts, and a little bit of round 2 has, but not all of round 2 and none of round 3. In fact, our state still hasn't submitted a plan to the federal government to get the remainder of the round 3 money. So our state's going to have about $15 billion. Some of it, again, has been distributed to districts, but much of it, majority of it, is being held by the governor right now. And he refuses to send that money down to districts, even though that's what the law requires. The federal law required those federal dollars to get to school districts so they can make sure they have everything they need to keep the learning going and keep everyone safe, and in fact, enhance the learning of our students, because we know last year was a year full of disruptions.
Again, the same gentleman is pointing out that we are causing fear and anxiety among parents for a virus that only killed 350 kids in all of 2020. I am pretty sure that the parents of those 350 kids do not feel the same way, that this is just fake fear and anxiety. And, my heart goes out to them. And additionally, we are not causing fear and anxiety. I don't believe a mask causes fear and anxiety. I don't believe social distancing causes fear and anxiety, or vaccinations for that matter. I would just like to address this gentleman who has been very active on the comments, and we welcome you and thank you for watching, because it means you're watching and you're listening and you've stuck with us for 30 minutes. So thank you so much for watching. Andrew, I don't want to take up any more of your time. I know you actually rushed home to be able to be part of this interview, and I appreciate it. Is there anything else you would like to add?
Well, let me just say this. I do want to comment on that. I think we should have a discussion about what makes sense. And we should base that discussion on the science, on the numbers, and on our community, right? And it's not about scaring people. It's about being real, right? We should not be afraid of COVID. And if we take reasonable measures and agree as a community that we're going to beat COVID, then we beat it. One of the things President Trump actually said early on is that we were in a war and we needed to beat this virus. I agree. We are in a war with a virus. And when you're in a war with a virus, you do everything you can to beat it back. I will tell you, you don't turn the weapons on yourselves. And so this idea of trying to blame and point fingers and all of that kind of stuff doesn't do us any good. That's all the politics of division. But actually taking reasonable steps that medical professionals, I'm not a medical professional, I'm an educator. I will tell you what's best and how to educate kids. But as medical professionals are saying, we should do some reasonable things like wearing a mask, social distancing, contact tracing, good hand washing and hygiene. Then let's do that. What's the harm in doing that to keep everyone safe? Get vaccinated. We've heard everyone say, get vaccinated. Even people who were initially saying, don't get vaccinated, are saying, get vaccinated. The Republican governor in Arkansas, I believe it was, who initially said they had a legislation that said you cannot have mask mandates, is now saying we should reverse that, because everyone's understanding that the best way to beat COVID and make sure that we protect everyone's life. So you can say that there's only been however many students who have children who have died from COVID. It's too many when you can prevent it.
That's the sad part. It's preventable. It's preventable.
Right.
So
let's not minimize it.
It's the Arkansas Republican governor that regrets having banned mask mandates. And I would like to add that the COVID vaccine was created during a Republican presidency and distributed during a Democrat presidency. So this is not about politics. It's very clear this is about health. Andrew, thank you so much for taking time. I'm sure that we'll see you in a couple of months once schools get started and everything is rolling, so we can have another conversation. Thank you so much for your time, and thank you all for your comments and for watching and for participating. Thank you so much and have a wonderful day. Thank you, Andrew.
Thanks, Helena.